Hi folks, my name is Horacio Rubio, co-founder and president of the Positional Therapy Pillow Company. We design and manufacture the special need mattress, the ComfyLiftBed. To tell you a little bit about our company, we started back in 1998. Even further back in that, in 1995, I was diagnosed with a severe case of acid reflux, GERD, and Barrett's esophagus. There was a need for a positional pillow for me, but in that time there was not anything available. I designed and patented my first product, the acid reflux pillow, known as a Comfort Lift pillow. Then came, as we continued on manufacturing and improving our product, we came up with another product. It was called the Side Sleeper Delight for sleep apnea, snoring issues. At that time, the VA healthcare system caught notice of us, and we was granted a FSS government contract with the VA healthcare system in 2004. In 2004, a mommy called and asked for help with her beautiful daughter. She called me the first time. I explained to her I couldn't help her. All we did was adult pillows. And she called me a second time, pleading for some help. So I thought I'd go ahead and stop everything and go right into trying to figure something out. Well, lo and behold, with God's help, we figured something out within an hour. We had a basic design. Sent the prototype directly to her, to Julia, and she did wonderful. So we have been selling and offering and providing the special needs bed since 2004. And we're grateful to all that has been said about it. And also the therapists have reported back to us, and the doctors, and especially the families, the mommies. So I'd like to go ahead and show you a little bit more about the ComfyLiftBed and how it's constructed and its features and benefits for the special needs market.
With acid reflux, sleep apnea, and other sleep breathing disorders being so prevalent in the special needs community, the ComfyLiftBed brings some relief. It has been and will be used as a system to help these children with these difficult symptoms. As newborns and infants outgrow the typical wedges that harness them, the ComfyLiftBed is a practical and proven system. We will briefly discuss the special needs bed mattress for you. We start off with the toddler bed. First of all, you will remove the existing mattress that's in the toddler frame, and you would place in first the head wedges and the foot wedges underneath the main body of the mattress. Now, the function of the base wedges for the feet and the head wedges is for adjustment. As the child increases in height, you may remove some of the wedges as needed. This helps to maximize the use of the bed for the maximum amount of time. Now, there is an optional feature. If you have a child that's had difficulty moving, he has trouble raising himself or moving around, there is the adjustable back lift. Now, that is placed in a vinyl pocket, the head portion of the bed, and very quickly, within just a second, you may raise the child from a laying position to a sitting position. It's very useful for respiratory therapy, like the smart vest, or for feeding programs, grooming, or severe reflux. Turning our attention to the adolescent, that fits into a twin size frame or can be used as a freestanding unit in case of a safety issue, and or you can use it in a mechanical bed. But keep in mind, in a mechanical bed, only the head portion could be raised and the leg portion of the mechanical bed will not be used. All of our beds come with a leak-proof vinyl cover. That is a high-grade medical grade cover, easy to clean, keep up with, as well as a cotton custom wrap used as a sheet. A little bit about the construction. The construction of the beds are basically this. The center core is normally a more sturdy, long use core foam, And the outer portion where the individual lays on is a super soft foam. And in the adolescent size, we have added some memory foam right in the posterior area for long-term use and to help with the issues at hand for being in a bed for a long period of time. We have noticed that in the design that we have come up with, it's a V shape. It's different from a mechanical bed. There's an even distribution of weight in that. So we thought we'd point that out for you. It has been beneficial. You might try that if you have an opportunity on an adolescent/adult bed. We're happy to mention that many of the state Medicaid programs have paid for the bed, as well as private insurance. We're so happy that you've taken time to review our bed, our system, and we'll be happy to help you, continue to help you with any of your clients. So thank you very much and have a great year.
We'd like to present to you some powerful testimonies that the mommies and the families have sent back to us. This way you'll be able to understand how much this positional bed has been doing for these families. So stay tuned, keep watching and listening. Thank you.
Hi, I'm Stephanie. My son Lucian's had a ComfyLiftBed for about 2 years now. We got the toddler size that actually fit very well in a toddler bed frame that we had already, that we were able to convert our crib to the toddler bed, and the ComfyLiftBed fit perfectly right in it. Thankfully, it was very easy to put together into the bed. I was able to do it by myself without any problems. We got the ComfyLiftBed at the doctor's recommendation because my son Lucian needed a bed that would allow him to sleep on an angle. Lucian has very severe reflux. His reflux is to the extent that he lives on a feeding tube. He's NPO, he doesn't take anything by mouth at all, and his feeding tube is hooked up and runs 24 hours a day. So we needed something that we knew would help so that he wouldn't wake up in the morning and vomit, but we also needed a bed that wouldn't allow him to move around too much while he slept. We needed to make sure that his feeding tube would not come dislodged at night, that he wouldn't get tangled in it, that, we knew he could sleep safely with it. What we hadn't anticipated that was a pleasant surprise is Lucian has Ehlers-Danlos syndrome. It's a connective tissue disorder that causes joint pain, and he really needed a bed that would allow his legs to be elevated as well. And the ComfyLiftBed actually worked very well with that also. So it really helped cut down on the leg pain that he was having and waking up with in the morning prior to getting the ComfyLiftBed. It's a product I would definitely recommend to other parents who have children with whether it's GI issues, joint issues, or even conditions where they need to just make sure that they're not able to move around too much while they're sleeping, but yet still be comfortable at the same time. I know the type of foam that the bed is made of. My son always found that to be very comfortable for him, and he climbs in at night and he's asleep right away. It was a product we're very happy with, and I would definitely recommend this product to other families looking for a bed for their child, or even other doctors looking for a product to recommend to their patients. So thank you, ComfyLift. Thank you for a great bed that's really been a big help for my son.
Hi, my name's Beverly, and this is Chris.
Hi.
And he's got cerebral palsy, and we got one of the beds about 2 months ago, and he slept on the bed. It was like he just kind of melted into it. He's been real relaxed and stuff. He had massage therapy the day after he got his bed, and the massage therapist wanted to know what was up because he was so limp. And anyway, he's a lot more relaxed. He sleeps a lot better, a lot longer. He was getting up at like 6, 7 o'clock in the morning. Now sometimes he'll sleep until noon, and he's just a lot more relaxed and seems to be a lot more comfortable while he's sleeping.
Hi, I'm good. I've had the bed for a few months now, and it's really comfortable. And I love the ComfyLiftBed.
We felt very blessed when our twin daughters, Ava and Audrey, were released from the NICU unit. We were, in fact, blessed. Our daughters were born 7 weeks early. Audrey had been born with a hole in her heart, and developed pneumonia. Fortunately, she overcame her challenges. Otherwise, the only problem both girls faced was acid reflux. The doctors assured us that the medication would be enough to take care of the problem. The medication, however, was never enough. We had to keep both girls upright between 30 minutes and an hour after every feeding. They could not lay flat on their backs or bellies. We had to burp them at every ounce of milk. In desperation, I spent the day surfing the web for some type of solution. Most sites offered some type of a wedge pillow that I could quickly see would not work. The babies were simply going to slide off. I was desperate, and my babies were miserable. It was a few nights later when I discovered the Positional Therapy Pillow Company and their toddler bed mattress. Instantly, I was sure that it would work. It just looked right. In tears, I shared my discovery with my husband and together agreed that we would just have to find some way to pay for the mattresses. We got the ComfyLiftBed less than a week later. The first couple of nights were hard on the girls. I don't think it was the mattresses, but rather that they were no longer sleeping in their cribs. They were a bit cranky for a few days and then nothing. No crying in the middle of the night. No fussing. No cranky babies in the morning. Nothing is great. During their last checkup, the pediatrician confirmed that both babies are gaining weight and doing remarkably well. Once again, we are blessed, this time with Mr. Rubio's creativity. There is no question that the ComfyLiftBed for toddlers has improved the quality of life my girls lead. I would highly recommend it to any parent of a refluxing child. The bed works. My 4-year-old Ian was born at 29 weeks. He has always suffered from reflux and obstructive sleep apnea. After multiple reflux surgeries, he was left with nerve damage and began producing excessive amounts of mucus. He also developed periodic limb movement disorder, a predecessor of restless leg syndrome. He's been sleeping in a ComfyLiftBed since he was 18 months old. The bed not only helps manage his medical diagnosis, but gives him comfort and allows him to grow. He has a surgical feeding tube as well. The bed makes it much easier to give him his overnight feedings. Because of the ComfyLiftBed, we notice less reflux, less mucus production, and more restful sleep. We love the additional wedges that can be placed at the head or foot under the bed to allow for additional balance between head and foot or increased elevation for comfort, illness, etc. Because of the medical diagnoses, we are able to get the bed covered by his Virginia State Medicaid. We plan to use Ian's bed for a long time. I highly recommend anyone with medical issues that produce positional challenges to invest in a ComfyLiftBed. You won't regret it. My son Zane was born a very special little boy who has a rare genetic mutation of his genes known as lissencephaly. Along with this diagnosis, Zane suffered with acid reflux, obstructive sleep apnea, and has problems taking food by mouth, so is fed by a G-tube. The ComfyLiftBed is a lifesaver. Zane no longer has major issues with acid reflux or sleep apnea. It is easy to travel with for hospital stays or spend the night at relatives, and Zane loves laying in it for naps, bed, and his G-tube feedings, and we've even used the removable wedges for tummy time. This bed has a more than one great usage for my son and is great for special needs children. The customer service is great and easygoing, which is really nice for us special needs parents due to all the other stresses we have. I am very satisfied with my ComfyLiftBed overall, and Medicaid paid for my son's ComfyLiftBed.
Well, folks, thank you for coming by. Now that you've seen the features and benefits of our positioning ComfyLiftBed, and you've heard the powerful testimonies that mommies have been sending us, then you too can see the many clients that could use this bed. I'm sure you're thinking about that right now. Many of the Medicaid programs throughout the country have paid for this bed, and also private insurance. So take this information, talk to the doctors, talk to others, and thank you so much for coming by.